So what we thought we are going to do, we don't have to stay here now for the rest of the 1 hour. But I think it's important, since we're here, that a few things that we can use. We can use this opportunity for a Q&A. As most of you know, I have received fundings in implementation science from NIH. I have reviewed grants in implementation science for NIH, including those for K43s and the grants that are coming in for training grants from LMICs, and also for that type of grant LMIC. And also use this time to also ask you if there are specific areas that you want us to invite someone to speak. One of the things that we know for sure is that we can invite any good speaker from any part of the world. So if there's a need and there's a topic area that you would like us to invite someone, this would be a good time that you also can put those things on the chat box, on the Q&A box. So the Q&A is enabled. That allows you to be able to put question there, and we read it out here. And remember, please don't put them on the chat box. We won't read them from the chat box. Just read them from the Q&A. That makes it easier for us to read the questions and also respond to them. So while Dr. Nyek, if there are questions on the Q&A, you let me know. While you're doing that, I am going to go ahead and take people. So once there's a question there, please stop me. What I'm going to do is, again, use this opportunity to share my slide and be able for people to look at the things that I'm going to take you to research.gov, grant.gov, and grant.gov is where you will see the NIH grants that are available to share. So let me know, Dr. Nyeka, when you start seeing my slide.
I can see it right now, sir.
Okay, so I'm going to go back to the beginning. Can you still see that?
Yes, sir.
So keep an eye on the Q&A box and stop me if there's anyone. So I'm gonna just spend about 5 minutes, but stop me once there's a question. What I wanted people to know is to be able to see how and where you can also look for NIH grants. This is grant.gov. So if you're able to get to this page, one of the things I usually do, if you look here, you will see that there are 2,896 match for grants that are available. So I try to limit them. You can search for CDC grant here. You can search for NIH grant here. I am going to limit them for NIH grant. So, and I want to limit them to look at implementation science. So if I go to the keywords here, and then I type implementation science. So then that limits what I'm looking for. Then I can go down. You can limit it by so many different ways. Like I can remove forecasted, but I will leave it just in case there's any in the forecasted area. Because also I look at this things and check that you can sign up for this, specify. I get an alert every morning, and I look at this every morning. I look at every morning not because I am going to be applying for the grant, but we have a center, and there are many people that are also applying for different grants. So one of the things is when we see something that fits anybody in our team, then we're able to send that. So when I go to the agency here, I go to Health and Human Services. As you can see here, I click on the plus sign. Then it brings down another more dropout. Then I go down and I'm looking for NIH. You can see the CDC here if you're interested in CDC grants. So you can go down here and you see National Institute of Health. So I click on it. And that brings back this number to me. So here there are 226 grants that fit what I was looking for. And these are things like implementation science grant. You still have to go over them and be able to see if there are things that are important to you. But this is something that I look around and see if there are things. If you want to reduce it further, I think you can remove cooperative agreement. You go on grants. You can remove all. Here I have it at all eligibility, so you can narrow down things like that, and then that helps you to put that. You can have I have all have things here, you can narrow down to just health. So, but this is an area that is wide. You can see things on mental health. You can see things on different areas that you want to be able to. You can see things on big data. So it spreads out in terms of what people are. You can see drug abuse and drug use. So there are a lot of things that are here that fit into the type of place that you want. The other thing that you can do with this is that you can go to the closing date and look at, I click on the closing date. So he rearranges it for me and it tells me the ones that are closing from 2026 coming down. So it gives you those 3 years. Yeah. So you can see the things here in terms of, this is something that I always tell people that they don't always remember this. This is investigator-initiated extended clinical trial. These are things that can be done by you. You don't have to wait for any topic. You can pick on this if you have a good idea and a good project and submit it as an investigator and initiated study. NIH has that. For those who do HIV, you can see that most of the times you see these things, they come in triples. When a grant comes in triples, it means it comes in R03, which is the basic grant. It comes in at R21 and they come in at R01. So if you look at this one here, innovations to optimize HIV. And the good thing about it is that you see this grant, it was posted January and it's open to 2026. And then every year you have 3 opportunities to sign into this grant. So if you multiply that by 3 times 3, that's you have 9 opportunities to apply for this grant. I like this type of grant because what it does is that once I see it, I may not be able to submit the first one, but I begin to prepare for that grant so that in the next 6 months, I have a well-written grant and then I submit it and I still have a chance to revise it and submit it before it ends. So that's one of the good things about grants like this. But this is one way that you can narrow down here. There are standard grants I want to point out to you, which is here. You can see those things. You say dissemination and implementation research in health. It comes in triplet. So this is something that I like a lot. So you see the R03, you see the R21, you see the R01. Okay, so dissemination and implementation science, this is R03. And then as you go down, as you go down, you see the R01s. We're going to look at the R01s. Well, let's click this one, for example. And Dr. Nyeka, remember to stop me if there are questions.
Yes, I will.
Okay. So here is a grant on dissemination and implementation research in health. It's an R03. And we have discussed this before, but when you open this grant, and Dr. Nyeka, you can see the open grant, right?
Yes, I can.
Okay. So the first thing that you want to look at will be, I always say, go down to legibility. So click on this particular link for additional information. That opens the whole grant to you. So when you open it here, it tells you the institute. NIH has 27 institutes and centers. It tells you the ones that are participating. I have received grant from this, so they're always interesting to me. I have received grant from NICHD. They're always interesting to me. I've received grant from National Institute of Mental Health. They're always interesting to me. But you can see everywhere, and I have received grant from Fogarty, where Rachel is, and this has been very interesting to me. So you can look at that. You can see different areas. If you're a neurologist and you're working on things about stroke, if you're mental health, if you're using drug abuse and behavioral science, if you're a dentist, if you're a pediatrician or an obstetrician, if you're someone that is dealing with alcohol abuse, and then if you're dealing with older people, there's an institute for aging that is really there. Of course, if you're doing genome studies or cancer studies, so you want to look at that. But before you go any further, my thing is always to go down here and see that you do qualify. But before I go down, you see what I was talking about? Look at those. You see the whole kind of dates that are available to submit this grant, all true. So this is new grant. It's first available June. So 2 has already gone in 2023. The February 2023 has gone. The next one is June 6, 2023. The next one is October. The next one is February next year. The next one is June next year. then you see October next year, and then you see, so you can see these dates. And that's how you can plan for this grant. So it gives you enough time to plan for this grant. But if you scroll down all the way to this grant down here, this is one place that you want to be able to look at. Non-domestic foreign institutions are allowed to apply. So this tells you that you can apply for this grant from Nigeria or from any African country. So that's very important for you to know. If it's not eligible, then you want to, so you don't waste your time doing that. So this is one of the things that you can do in terms of checking here, in terms of foreign institutions. So once you know that foreign institutions are allowed, then you can come back to this place and then look at the centers depending on your specialty and your own expertise. You can see each of them what they are interested in. I always look at examples of relevant topics included but not limited to. I first of all look to see. So if you look at this particular one, this is in general, and you look at the studies on culturally tailored implementation strategy to enhance the adoption and integration of health promotion, prevention, screening, diagnosis, intervention, as well as effective treatment. This is really the kind of study that you would like to apply for, which is one of the reasons that I'm drawn to implementation science. Because in implementation science, they do recognize that culture has an impact on how things are implemented. Just because it worked in the US or in Canada doesn't mean it's going to work in Nigeria without adaptation. So tailoring and adaptations are very important. So here is one place you can find out a lot of type of studies that are funded. And because you have enough time to go into the years, multiple years, you're able to prepare this, you're able to assemble the team that you need to be able to do this. One thing that we do at the Center for Translation and Implementation Research is to offer you an opportunity for a consult, which means you can send us a request for consult through our website, cti.org, and then we're able to provide you expert consultation on a project you're designing on dissemination and implementation science. And we also have a collaboration with DISC. DISC is the Dissemination and Implementation Center at University of California, San Diego. And they have been, Gregory Aarons, like most of you know, have been in Nigeria since 2015, also doing NISA, and he's going to be there again this year. And they will take up a consult from you if you're coming in from NISA or a NISA partner, and then be able to provide you some input in your designs of your studies. So those things are available for you. That's one of the things we're trying to bring here. And did I say that we provide those things free for you if it is a consult. One of the things we can help you also that we have the program is every year we do have one program that we send out, and we call it the CTR Scholars, where we send it out to people, and then we get people input back. It's a 24-week mentoring program that we call our investigation development program, where we take you from looking at this grant the way we just did to being able to match that grant to your expertise, and then be able to help you throughout. It ends with the submission of grant. So we usually, if people do not finish their week, then we drop them for that week and move to the next set of people. So it's a little bit of a pyramid. We start with reviewing your biosketch, make sure your biosketch are good, and then for you to change that if it is not, we spend a week on that and then move to the next thing, look at the grant, match your grant, then we start building down each section of the grant. The idea is that over a 24 weeks period, you're able to work at that tempo and be able to submit a proposal. Each week that people drop and didn't complete their last week, then they drop out of the program. So it is a little bit intense because we're also spending 24 weeks with you for free. That's one of our most intensive free projects that we have from the center. There are other paid programs that do a one-on-one with you, but this is free, and we do that once a year. We just finished collecting the advertisement. It ended in February 5th. We are finalizing the selection, and we were supposed to start March 1, but a little delay. So we're still hoping that we can start the project in March 15, and that will be for 24 weeks. So let me stop here. There are 2 questions I see in the
Okay.
Q&A, or 3
You
questions in
have
the Q&A.
three questions, yes.
So let me
So,
stop here and then let's do that.
okay, so let me read out the first question. So for someone who is new to research, which of the grants would you suggest to that individual? And what would be the requirements?
My suggestion to that individual is to start with an R03. That's why I opened this grant. So this grant that is open in your screen is the best grant that I would tell the person to start. So this is an R03 grant. So if you look at it, it's an R03, but if you look at it, it has the other 2 components that I told you about. It's the same grant. This is an R21, this is an R01. The R03 is the smallest of the grant. It is $50,000 a year for 2 years, $50,000 a year for 2 years. The interesting thing about it, it does not require you to have a hypothesis. So basically, what you do is to define that. So look at this. You say the purpose of this something is a support study that will identify, develop, test strategies for overcoming barriers to adoption. So this is a very, very, even including the implementation. So this is the grant that I will ask you to apply if you are new. For example, the investigator development program that we're doing, everyone in the team is going to be writing this grant, this R03. So we're hoping that all of them will submit an R03 at the end of the day. The second reason that I like it is that it only requires you to have a terminal degree. I think it still does require you to have a terminal degree, which means you have your PhD, you have your MBBS, you have your pharmacy terminal degree, you have a veterinary medicine terminal degree. So that's one of the requirements that is expected here. And I'm trying to pull that up here and see if it is here eligible. I don't think you went into detail here, but one of the things here is that you have to have a terminal degree that I remember. You can have multiple PIs, which means 2 people can write this grant. You can write it with a senior person. That's one thing that you can do. But R03 will be where I would say start, and then you have your idea. It helps you go through the process and understand that grant process. So anybody that is involved in our investigative development program will be writing an R03. It's 6 pages instead of 12 pages for the R01. So it's a smaller, but it's focused, but it has all the same component. That once you're able to submit this grant, you're more likely to be able to submit other types of grant. Yeah. So I hope that answers your question. If not, please ask me for an extended one.
Okay, I think there are 2 that are closely linked to this one. So someone, and I think you've answered one of them, which is, can an undergraduate apply for grants?
An undergraduate can apply for a grant, but this is not the one that the undergraduate can apply for. I would always say that if you're an undergraduate, I don't think you should try to apply for a grant alone. You should use the opportunity to be. So remember that when R02 is reading, grants in NIH especially are not individual, they are team science, which means there's a team. So I think as an undergraduate or medical student, one of the things you could do would be to write a grant with someone. That is the best way to do it. Be part of a grant writing team. Bring in some expertise that you try to develop. Because at that point, you're undergraduate, most of the time you really don't have an expertise. So what I always say is work with them, say, if we get this funding, can I be the project manager? That's one place to start very well. It's always the best place in my mind, because as project manager, you understand the whole process of the grant. So that's one of the things, but you have to be energetic to work with the team. But that's where I would start if I was an undergraduate.
Okay, the next one says, what's the difference between an R03, an R01, and an R21?
So we mentioned it again, the R03 does not ask you for a hypothesis. It is to generate hypothesis. So if you're starting off, the first thing, like you said, are old people likely to, that you are noticing, let's say you're noticing that old people, when they have HIV and I'm just using HIV because I'm an infectious disease doctor, that if they have HIV, that as they get older, that the HIVs tend to accelerate faster, and that you think it might be related to the age and the other comorbid conditions they have, but you have no hypothesis. All you want to do is to take a look at all the data that is about HIV people above 60. You want to collect a cohort of them. You want to look at variables on them to be able to generate a hypothesis. That is an R03. That allows you to generate hypothesis. It's a small grant. It answers a specific question. You can also use it to do a small immediate thing. Say, I developed an intervention. I want to see, refine it a little bit, to look at it, to I can develop it, really, that I can develop a way for you to increase antenatal care for women. And you have an idea how you can increase that, and you want to develop that. Remember, you have not developed that. You want to develop that. That's an R03. So it's very one of the basic, allows you to develop those things. And R21, assuming you now say, you now develop this, you now got an R03, you developed this tool that you want to increase maternal antenatal attendance by pregnant women, and then you want to test whether this tool is working and refine it and get it in. You go to an R21. An R21 is a development grant. And what it allows you to do is a little bit more money than the R03. It is $125,000 a year for 2 years. What it allows you to do in the R03, you have a hypothesis. You didn't have a hypothesis, you got one. In the next one, you want to pilot and test that hypothesis. Or you have a tool. In the R03, you didn't have a tool, you developed the tool with R03. Now you want to test the tool a little bit. That's an R21. Then once you have had a tool, you developed it, so now you have a hypothesis, you go to an R01. R01 is the largest grant. It starts from about $500,000 a year for 5 years. And that time you must have a hypothesis, you must have preliminary studies. So by that time, it's better that if you already have either preliminary studies from other studies, or most time people will have an R03, an R21, and an R01. So an R01 is what makes you an independent researcher. Once you have an R03 as a PI, you become an independent researcher, which means you lose a lot of the benefits of being an early person anymore. Once you get it, nobody regards you as an early investigator. They regard you as an established investigator. Remember, when you're starting new, which is when you are within 10 years of your graduation, which is the best time to apply for a grant. If you apply a grant with me and we get the same score, you would definitely be funded before me. So if you got a grant and I got a score of 30 and 20 and you got a score of 30, you might actually get funded, with a 30. Remember that NIH, the higher the number, the lower the score, the impact. So if I got 20, which is a better grant than 30, me and you are in the same group, we've submitted on the same grant cycle, you're more likely to get that grant before me. You have a 10-point, up to 10-point advantage over me. But once you get an R01, then that advantage goes. I hope those answer the questions.
So your next question is, as an early career researcher, how can one get the first grant from NIH, considering one may have little or no experience in implementation research? As he says, we can also draw experience from how you landed your first NIH grant.
So my first NIH grant is a little bit atypical. The reason I say that is that I was in an institution where there was no one with an R01. And the best way to write an NIH grant, in my opinion, is to write what I call a mentored grant, which is a K43. A K43 is a beautiful way to go because it's a mentor. You're writing it with surrounding yourself with mentors who can mentor you into writing those grants. It's the best way to go. So you have an area you want to focus on. You get mentors together. You propose a little pilot studies, but what it really does for you, it protects your time to learn the skills. So a K43 is another grant that I think is very, very important for you to do. I was going to show that here if we have some time, but it's one of the ones that you can do is a mentored grant. For me, before I got my first NIH grant, I already had about 20 grants, which are 1 year grant from here. So for you to be like a small grant from the Nigerian, the grant funding agency in Nigeria, TED Fund. Yeah, it might be a small grant from TED Fund. It might be a small grant from WHO. It might be a small grant from Bill and Melinda Gates, then you're able to come here. So for me, I had those. I'm a clinician, so I didn't start my career as a researcher. I started my career 100% seeing patient. So I was trying to buy my time. The way it works in the US is when you get a grant, you use it to buy your time. So if I get a grant that is 20% of my time, they cancel one clinic day for me instead of every day. As a consultant in the US, unlike in Nigeria, you see patient every day. I have a full clinic every day from 8 to 5 every day. Every 15 minutes, seeing patient for 5 days a week. That's how you are a doctor in the US and a consultant. So this is not, we don't call it consultant because that's different. In the US, it will be an attendant because we do actually have a full clinic if you're in clinic. And if you're on the floor, you see patient on the floor. So because of that, it's difficult to do research. So one of the things you do that when you finally, I always say you work 125%, so that you can land at 100%. So during the time you have this clinic, you develop this grant, but once you get a grant, like 20% of the time, the first thing you do is that the university takes it, takes that money, and then releases you one day. So they cancel your Mondays. And then you are like so happy because on Mondays, you no longer have clinic and you can start to build your research career. But sometimes what happens that those grants you get the first time is for 1 year. So you get already, but you're writing for the next one because you want to keep that. And that's how I got to 20 grants before I actually got enough time to get an NIH grant. But the K43 protects you and give you 75% of your time. They pay your salary for you to focus on research. It's the best grant in my opinion. It's competitive, so you have to compete for it. But the other grant that is there is the R03 that is in front of you. It's a small grant, but again, you do not have to do it alone. I don't think that your first grant you're writing as somebody who have no idea of writing grant is to go and write a grant. That's not the way to do it. The best way to do it is actually to belong to a research grant writing team. We have one. I'm sure many institutions in Nigeria and depending where you're listening from, have those kind of teams. For example, in the UNN, there are about 200 research teams. And to join a research team, because you can be in a team, research in medicine, especially nursing, dentistry, pharmacy, all of them are team science. It's not something that you do, but also remember how you put your team is not a collection of pharmacists that have the same interest. No, it's a collection of people that have different skills that they bring to the table. Some people may bring analytical skill, some people may bring design skills, some people may bring disease prevention, some people may bring anthropology and cultural things. So there are things, it's a team, a diverse team that is complement each other. So the best thing to do, I say, is to belong to a research team. There are many of them in Nigeria, and then you learn quickly. And then the second thing is to say when someone more experienced is at the grant, to say, can I staff your grant? In our team, we give that opportunity to everybody to have a chance to staff a grant. When you staff a grant, you basically work for the team that is writing that grant. You are not on that grant, but amazingly, you gain so much experience. They will ask you to draft letters of support. They will ask you to help with the CV. They will help you to help so many different things, but you will learn each component of a grant, which is what you're going to need on your own. And by the way, when you belong to a team and you do that, then when you're writing a grant, there'll be other people doing that for you. So that's why it's beautiful to belong to a research, a grant writing team or a research team in your institution. I hope that answers the question.
Okay, the next question, we have 7 questions. The next question says, for those grants where they specify no clinical trials allowed, are quasi-experiments, that's non-randomized controlled trials, allowed?
Yes, but the thing is that I learned recently, because those things have been very confusing. I always say, if you are in doubt, make an arrangement to see your program officer. In our team, one of the things that I do for our team members is that I arrange a discussion with the program officer and I join them. I have quite an experience doing this, and then I joined that person. I've done that more recently as last week. We call, send an email, have an idea, we send it to the program officer and request a meeting. That's part of their job. So they will meet with you and then they will look at it and answer your question. So our question was that, is this clinical trial or this not clinical trial? There are sites and NIH, is this clinical trial? It asks you 4 questions. and you decide whether it's clinical trial. And what I notice is that most of the time, if it involves human being, even if it's just collecting behavioral data, that it does qualify as clinical trial. I used to think that it's only when it's randomized that is clinical trial, but no, that's not how NIH defines it. So if you go to NIH website, just type the thing, is this clinical trial? It will bring you the 4 questions, you answer them, you automatically know whether your stuff is clinical trial or not clinical trial.
What is your advice regarding getting the right mentor or mentors when applying for a grant?
Yeah, the biggest thing about getting the right mentor is to be the right mentee. People talk about being mentors. No mentors want to waste their time. So a mentor wants to see somebody who is likely to succeed. That's how the life works. You have to prove yourself, work yourself, and be a good mentee. A good mentee is someone who has a fire in their belly, who wants something, who know what they want. So I want to develop myself in research. I'm interested in non-communicable disease. My focus is on hypertension and how to reduce hypertension complications. Or my patient is on pregnant women and I want to reduce maternal mortality rate. Or my interest is in pediatrics and I want to increase immunization rate for children. You have to be very specific in what you want and then be able to clearly define it. Self-development, first of all. You get a little bit of that information, then you write to people that you think are in that place that have the expertise and said you would want to discuss with them about if they could be your mentor. So it's a discussion. It's actually like, dating. So you don't always look for somebody who has experience, who is not, that doesn't mean they're going to be the best mentor for you. You're looking for somebody who your idea also interests them. So you have a discussion with them the first time. Say, this is my idea. Is this an area you have a focus? Is this an area that interests you? Is it somebody that wants to spend their time on you? Mentoring is a lot of work when done correctly. Almost most times you really have to, most of the time, that's the truth. Unlike supervision, you have to like the person that you're mentoring. They irritate you and they are not really going to do a good job because first of all, they're not paying you. You are not getting anything from their grant. So there is something that you want to do. So to get a good mentor, one of the things is to say, how do I become a good mentee? How do I become someone that people want to reach out? I actually reach out to the people I want to mentor. To call them sometimes and want to mentor them. Sometimes they even turn me down. You wouldn't even agree on that. But it does happen when I've called somebody that I want. I really think they have these things. I'm one of those that at my career stage, I have been a tenure professor. I've been in the US for 25 years. I have gotten all kinds of grants. My career has been blessed. And I feel like whatever is remaining of my life, I think God keeps me here because of some other reasons. And one of those reasons is for me to mentor people and be able to do them. So I take that personally, that I actually search out people that are doing well. I go to PubMed, I look at publications from Nigeria, I look at what people are looking, I look at people that interest me, I put their things down, I even call them and say, what are you working on? Because I'm really trying to help them out. It is not always that you get people like me, but I'm sure there are people like me out there. But I actually look out for mentees that are like that. So the way I ask myself, if you want to get a good mentor, how do you become a good mentee? And one of those things is to do your part. If you're coming to me and you haven't done anything and you finish your graduate for 10 years, you have no publication, I'm going to say, what have you done? This is not somebody who have indicated interest. But let's say I see you and you writing publications, but you have no grant. I've done that for a lot of people. I called them, I said, you have done a lot of papers. You have 20 papers and they're very nice papers. I think, have you thought about writing grants? And they say, oh, I've thought about it, but I never had a mentor. I said, do you want to work to it? And they're like, yes. I said, okay, do you think you have time for it? They say, yes. Do you think you would like me to mentor you? And this is some of the things. So I use those questions that I, as a mentor, is looking for. So that when you do get to find a good mentor is to have someone that matches you as a mentee. So the first question is that how do I become a good mentee? So once you answer that question, you're on the very good pathway to getting a very good mentor, because you can actually interview them like in a dating process and find the one that is a match for you.
Okay.
I hope that answers the question.
Yeah. So someone says, can persons who are co-investigators in an R01 grant apply for an R03, R21, or K43 grant?
Yes, the answer is yes. You can, if you are co-investigator in any of this, the an R01, that's a good thing about it. Sometimes when people are new, I always encourage them not to even focus on R01. But even when you are co-investigator on R01 or anything, as long as you are not the PI, if you are the PI on MPI, no, you can no longer qualify for a K grant, but you can always qualify for an R03 and an R21. So the R21 and the R03 does not have a whether you've gotten a grant before does not matter. The Ks have. If you have been a PI on a major R01, you would not be eligible for a K because you are now, remember I said, if you get an R03, even as multiple PI, you become an independent researcher and you no longer, you lose all your advantage as a young person that is doing research. So my advice to most people is that don't go for an R01. When you're starting your career, go for an R03, go for a K, go for an R21.
Okay, good. So Christopher here says, during project implementation, you try so many approaches to get results. How does one convert such approaches to grant writing opportunities?
Most of the things I see people that they do in Nigeria is something that they were gotten them a grant. There are so many projects I've seen that people do that would have gotten them a grant, but the challenge is that they don't know how to look for grant, they don't know how to write a grant, they don't know how to build a team. And then they end up sometimes even using their money to do this project. When you have a good idea, that's what is the most important thing. The hardest thing to do is to have a good idea. When you think you have a good idea, remember that research is research. So research is a thing that answers questions that are yet unknown. So when you are doing a program, you are there generating questions. Anybody that have done a program will realize that if they are smart enough, they will have many, many questions. And those questions are what grants are. Grants are money to answer scientific questions. So they are not money to deliver programs. But in doing programs, you have many, many questions. And from there, you generate questions that need answers, and those answers need money. And that means you need a grant. So every good research project needs money. When people tell me they did this project, this research, I say, who funded it? They say, no. I said, how did you fund it? I said, I funded it by myself. I laugh because usually they are not very good because these grants require money. That's the truth about them. They require money to do, money to hire research coordinators. In our team, we have 12 research coordinators fully paid across all the 6 regions in Nigeria. That's a lot of money. If you see our budget, you are going to say, whoa, because just that alone is a lot of money. But you need that team to be able to do a good project and answer a good question. So grants are what it does is to provide you money to answer the questions that are of importance, the questions are of interest to the funding agency. So when you are doing a program, what you're always looking at is challenges and how to overcome them. Questions unknown that is not answered. Somebody come in and said, we're having so much problem with our, sickle cell newborn screening, and then we're not doing well. When we're trying to implement this project, this is some of the problems we run into, and we still don't know how to solve them. Those are the things that require grants.
Okay, so we're down to the last 2 questions. The first is, when is the next cohort for the CTI Investigator Development Program? I guess it means CTI Scholar Program. When is the next cohort?
Yeah, the next cohort we are going to do, this is our first one we are very excited about it. We're going to take some people across the country that we request for that application. So that application, again, will be on my LinkedIn, on the CTI website, and on the NISA website. So if you follow me on LinkedIn, you will see it when it's announced. You can also go to cti.org, or you can also go to nisaresearch.org. So these 3 places are the places I would say look out for them. We put it out for the people to apply for. We set out 24 weeks of intensive 24 weeks. And we want to end up, like I said, everybody that's going to be on that team is going to be applying to this grant that is in front of you. So we are going to say, start with your ideas. We are going to go through the different processes, how to find this guy, how to read this guy, how to understand it, how to match it to your thing. Then we go to one of the most important things, which is how to develop an interesting research question. And then from that, how to develop a interesting research question, we begin to write specific aim. From how to write a specific aim, we begin to develop that specific aim into a proposal. And the idea is that at the end of it, they submit grants. So the next one is likely going to be we wanted to do twice this year. I'm not sure that we're going to be able to do that. So after this one, we're going to refine it, and then there will be another one in 2024. So we are going to have that call, but we're going to do that at least once a year moving forward. That is there. And that, again, is our commitment to development, investigator development program for Nigeria. So that particular is free to everyone. We do have paid programs that goes into 3-month cycles. That is 12 weeks in terms of helping you develop your grants. But that particular one that I'm talking about is free and is a commitment of the Center for Translation and Implementation Research at the University of Nigeria, and then the Nigerian Implementation Science Alliance to provide an investigator development program.
Okay. So as Justina says, please, can you recommend a grant writing team that I can join?
It depends on where you are. We for 3 years, we had one at CITIA that was open. We have enough members right now that we are not accepting open membership, but we do have what we call a collaborator track. A collaborator track is that if you have an idea that our team is interested in, we will bring you as a collaborator. And as a that collaborator, you will have a lot of opportunities that our members have. The reason that we don't have those membership is that where we got to the number that we want, but also that they're rigorous. We have 3 hours meeting every Monday. And then think about it that we have had 3 hours every Monday for 50 weeks for 3 years. And you are going to attend at least 50% of that. And if you don't, we will kick you out of the team. So it is a very rigorous team. So we changed the format because the last time we wanted to kick people out, they were not happy and they complained so much, and then we stayed back. But then it made us change our approach. That the only way we now admit people in our team is people who come into a collaborator first. That gives us an idea of who come into this. That's how we started developing the investigator development program, where we give that 1 year at the end of that 24 weeks. At the end of that, the very good people who did very well, we invite them to join our group. But our group is one of thousands in Nigeria. So there are many. I'm sure in your institution there is one. What is different in our group is that we are not localized. We are all across Nigeria. So we take membership from every part of Nigeria, actually from every member, every part of Africa. We just have recently have a collaboration with an university in Kenya that we're working with on a project. So that's something that is open for all of you in that case. But in your institutions would be the best place to do that. I see a lot of them on LinkedIn. And there's a lot of resources out there. Things have really changed. I remember when people have to do this type of webinar, it used to be 30,000, 40,000 naira. But now there are very good webinars that people do for free in Nigeria, and I'm grateful for that. That's one of the things we started when we started is to say, how can we really reach a lot of people? And then we started to do these seminars for free, and we invite people from outside, like we did with Scout. Next Monday, we are bringing in the deputy director for NCI Global Health, and she's talking, and she's working in cancer, and she's going to be speaking about a particular process of a group building model, which you use in research. So we try to bring a lot of that. So what I also do is that if I know of any Nigerian group of research, I provide them a little bit on my LinkedIn page. So if you follow me on LinkedIn, you will see me profile some of those groups that are there and say, this is what they're doing, this is the work they're doing, and give a shout out for them. And I usually call them, try to find out what they're doing and try to promote what they're doing, because I think there's a lot of more people needed to do what we do at CITIA so that we can increase the capacity of our people to do very good research. Thank you.
Yeah, thank you. So this question just popped in. It says, I'm also interested in joining a grant writing team. Can there be a database for intending members so that when there are opportunities, you can pull us from there?
We do have for CITIA, and one of the way we're doing that is to those who apply for that investigator development program. We don't always take everybody that is available because it is an intensive period. But when we have an opportunity from people who we're not able to join that particular program, then we will reach out to them. One other way to do that is to, if you, depending on the stage where you are, if you're on the stage where you are, you think you have a very good idea, you think of, write straight to us on the website at ctia.org, and then ask us that you want to be a collaborator, and then we will listen to you. One of the things you will notice when you join our troop, when you want to speak to us first, is that we will ask you to sign a non-disclosure, non-disclosure agreement. And the reason that non-disclosure agreement is to protect you. So everybody in our team signed that, and we have a lawyer that reviews everybody in our team twice a year to see their publications. The reason we do that is that when someone comes to us with an idea, we do not take their idea, and nobody in the team is allowed to work on that project without that person. So that gives confidence to people that come to us with an interest, to know that when they come to us, that their ideas are not taken. You come in and say, I have an interest here, this is my research proposal. We say, send in a concept sheet. Once you sign that NDA and send that concept sheet, that your concept things becomes your legal agreement with us. Our lawyer takes it, and nobody in our group will work on that project without you. It is important for us to protect you, and also, if you join our team, to protect other people's idea. Because for some people, this is what they got, is their idea, and we don't want to take it away from them. So we do have that kind of a database to that mechanism to be able to do that. The best way is to listen to this. We bring in this monthly webinar, but we bring in also something that is very important, like what we're doing from June 5 to June 9 is a research week. It's a whole week dedicated to research. And for 2 hours every day, we bring in an expert from around the country, around the world, and then we have someone from Nigeria or an African country who have done work in that area to partner. So, for example, we're bringing in David Chambers. David Chambers is well known for implementation science at NCI, the National Cancer Institute. He's going to be talking about study design, talking about hybrid study design, which is an implementation. What's the hybrid again? Effectiveness implementation design. So there's a design that combines effectiveness study with implementation study. And there are 3 types of them: hybrid, type 1, type 2, type 3. He's going to discuss this. Then after he discusses it for 45 minutes, there's going to be 15 minutes of question. But then the most interesting thing is that we bring someone from Nigeria who have actually used this design for their project in Nigeria to discuss their project. So that's one of the things. We're going to do the same thing with EPIs. Yesterday, we finally confirmed with 3M. So for anybody that is here who have used any of those things, Dr. Onyeka, if you can bring up the 3 top 4 data tentative schedule. If you are listening and you have used any of those 5 things that is going to be shown on the screen, please let us know that you want to co-speak with the invited speaker. So let's say you have used EPIs and you have used EPIs in your research project in Nigeria that is published or funded. Then you want to speak. Please let us know. We will pair you with Gregory Aaron. Gregory Aaron developed EPIs. What he's going to do, he's going to spend 45 minutes to talk about use of EPIs in research, okay? And then you are going to match, so if you're a person there, you are going to match him so that he speaks for 45 minutes, take questions, and then we give you 30 minutes to now say, this is how I use EPIs in Nigeria. So we're doing that for EPIs, we're doing that for REM, we're doing that for CIPHER, we're doing that for the hybrid effectiveness studies. It is important. I am going to be opening that week, and I'm going to talk about the soft skills that you need to succeed. The soft skill people need to succeed are the ones people don't think about, but one of them I'm going to be talking about is time management, which I think is one of the things that helped me in my career. When I left Nigeria to go to the US, one of the things I realized is that in Nigeria, we really don't have a lot of time management. So here is the initial research week that we're having. You can see the people that are going to be, a lot of them that are going to be working here, that is going to be working. That this is our invited speaker. what we want, we're looking for is people who have used that. So Enola, like you remember, they talked about the ERIC strategies. So these are selection of strategies that was led by the group, including Powell. Powell has been to Nigeria, to NISA, and is coming there. So if you're someone that is there, please look at those things and then be able to get that. So Gregory Aarons is APIS, Laura is Cypher, as well as Rogel. Russell is RIEM, and David Chamber does the hybrid effectiveness study. So what we are looking for is to be able to now have Nigerians who have used any of those things, who is interested in co-presenting. This is a great opportunity to grow your network, to make the person that you're co-presenting with, but show them that you have used the work very effectively in Nigeria. It opens up a lot of communication with you. Those are the kind of people you will now go back to say, hey, I am trying to develop my research career. Remember I presented with you, will you be able to mentor me? This is also what we create, is those enabling environment to be able to do that. So we are hoping that you will get an email. Send us an email at citia@unn.edu.ng to say, I've worked with APIS, I work with Cypher, I work with RIEM in Nigeria, completed my study, published it. I want to co-present with Gregory Aarons or with Laura Damancha. So thank you so much. And I hope that is something that is very important for you. I see someone that was certain on this, that I would like to look at understanding the role of public relations and implementation science. One of the things that I do a lot is what I call policy implementation science. It is a new field that is developing, and that's one of the things that I do much in terms of that. So I don't know if policy is the same thing that you refer to public relations, but if it is public policy, there is a very good, very good one. I hope this have been. I know that we're sorry that Dr. Rachel couldn't join us. Initially, I thought this was going to be maybe 15 minutes of a way, but it looks like there are more questions than we anticipated, and I hope that we were able to do justice to these questions and that you got some responses to you. But please join us every Monday, the first Monday of every week. We are always available here to meet with you. We have kept initially this number of people that join us from both the people who have joined us here, but also remember there are people joining us from live, because this is also going on live at YouTube. And so we usually will have about close to 500 people on these calls. But we have kept it open and maintained it free for all of you, because we believe that the more we can generate, the more we can interest people to see research as a career pathway. It is a career pathway, and a career pathway that is very fulfilling, the one that is also fulfilling to me and to so many other people. And there are so many people like me who have been blessed in their career, who also want to give of their time. People say it's hard to find a mentor in Nigeria. I say it's hard to find a good mentee in Nigeria. So that's the thing, is a mentee that have a fire in their belly, a mentee that have, wants to achieve something. And with those kind of wanting to do, sometimes there are sacrifices that you prioritize and do research. I want to thank all of you for joining us today, and we will reschedule that discussion with Rachel Stock, and I am happy. I'm sure that you'll be happy to join that discussion. Thank you all so much for attending.